This week we are going to learn about advocacy and its role in public health. Advocacy is really all about empowering communities. Advocacy is considered a fundamental basis of nursing, while social justice is considered a fundamental basis of public health. Public health nurses should be advocating for the protection of the health, safety, and rights of populations. In public health nursing, a primary focus of advocacy usually becomes health equity. Public health nurses most often work with vulnerable individuals and families, those who are oppressed, marginalized, disenfranchised, or underserved, and therefore at greater risk for disease, disability, and premature death. Although it is possible to improve the health status of individuals and families one by one, it is more effective, when possible, for public health nurses to take action to improve the health status of vulnerable populations as a whole. Caring leads to advocacy, and public health nurses care passionately about those experiencing health disparities. Public health nurses enter into the practice of critical caring when they recognize health disparities in individuals and families and work to change the context of people's lives to improve their health. It's not always easy to advocate for clients, either the individual or the population level of public health practice. Social justice dilemmas are part of everyday lives of nurses. What is different for public health nurses is that they often have to confront and resolve these dilemmas when they are out in the community by themselves. And in an acute care setting, like a hospital, ethics committees can usually help to resolve the issues. Public health nurses are often practicing alone, although they consult with other health team members when faced with challenging situations. Sometimes ethical decisions related to social justice and human rights need to be made during a home visit, such as reporting unsafe garbage in homes to the county sanitarian, contacting animal control about a client's pet that has just bitten a young child, or requesting court-ordered directly observed therapy for a client with active tuberculosis. Sometimes public health nurses carry out advocacy interventions by themselves, and sometimes they are part of a group advocating for change. The pervasive barriers to advocacy are economic, political, and public opinion obstacles. Political will is shaped by public awareness and opinion. The ability of public health nurses to create awareness of health inequities in their communities at the local or national level is key to influencing the health equity agenda of both the public and the politicians. Advocacy messaging generally needs to be tailored to the specific human rights or social justice theme and tailored to a target audience. The key messaging themes that should be considered when developing an advocacy message are very important. As stated before, advocacy messages need to be tailored. Key messaging themes that should be considered when developing an advocacy message include health as a value and social justice, human rights and governmental policies, environmental sustainability, economic cost of health inequities, and self-interest, in that inequities may lead to economic and social instability and may risk the health of others. Effective messaging strategies include cooperative approaches, social mobilization, and building a broader base of support, empowering disadvantaged groups, forming coalitions and networks with businesses, scientists, and policymakers, engaging the media, involvement in the political process, and taking advantage of windows of opportunities. Advocacy for health equity is defined as a deliberate attempt to influence decision makers and other stakeholders to support or implement policies that contribute to improving health equity using evidence. The types of data analysis that are most useful include program evaluation data, a cost-benefit analysis to assure policymakers that resources are being used wisely, analysis of the differential impact of specific policies to determine expected and unexpected outcomes, and presentation of narratives or stories to show the personal aspect of things. It is important to consider how data is collected and when and where it is presented. Effective data is recent, timely, and local. The data collection and evaluation process should include participation of community members. Disadvantaged and vulnerable populations have less voice and less power in shaping public policy. It is really important that we try to include them in any strategies that we have to shape public policy. To foster self-determination, facilitate empowerment, and promote self-advocacy, nurses need to create an atmosphere that supports and respects the rights of population they advocate for. Nurses also need to feel and be empowered to take action. There are a number of different ways that we can empower individuals or communities to take action. Personal power is the power you acquire and exercise through your informal and formal roles in your family and community. The components of these are personal roles, community roles, cultural and ethnic ties, and organizational memberships, like religious organizations, political organizations, or other ones. Empowerment strategies for these are becoming involved as a citizen with an issue that you're passionate about, getting to know your neighbors and community, identify yourself to family, friends, and neighbors or stakeholders as a professional who is committed to improving health in the community, participate in community or organizational meetings and share your knowledge, form linkages and networks between different groups and organizations, and know your elected and appointed officials. Professional power is the power you acquire and exercise through your formal role as a professional nurse. Some of the components include legitimacy through licensure, social contact through the public, professional expertise and competencies, membership in professional organizations, and professional networks. Empowerment strategies here are finding a professional and career mentor, joining a professional nursing organization, attending conferences and meetings, embracing the concept of lifelong learning, striving to provide evidence-based care, developing strategies for monitoring quality and safety of care, role modeling professional nursing practice, and becoming a mentor for other nurses. Finally, organizational power is the power you acquire and exercise through your formal and informal roles in your workplace and the healthcare system. Some of the components include position and job description, organizational communication, coordination of care, and dispersed power of nursing throughout your organization. Empowerment strategies include becoming involved in the work of the organization, becoming a member of a practice community, collaborating with people in other disciplines, joining an interdisciplinary group whose goal is improvement in patient care or population health, and working with a consumer group to improve healthcare in your community, or being politically active at the local level. Advocacy can happen at all levels. At the personal and individual level, nurses advocate for families and individuals by safeguarding their autonomy, acting on their behalf, and introducing them to social justice and provision of health care. Advocacy is aimed at building the capacity of individuals or families to manage their own healthcare needs. Public health nurses recognize the inequalities that exist within social determinants of health and challenge the status quo to change the social environment. When public health nurses advocate for individuals and families, they often do so within a trusting relationship. Public health nurses are aware that they can take actions to advocate for specific health needs of families that are related to both individual health determinants and social health determinants. They know that individuals and families can only change health determinants that are related to their own biological, behavioral, and life circumstances. They generally cannot change the health determinants that are societal in nature. To reduce health disparities, public health nurses need to be engaged in interventions at both community and systems level of practice. They need to spend most of their time working with individuals and families to modify their health determinants and reduce their risk factors and empower them to manage their own healthcare needs. Public health nurses that are interested in reducing health disparities among populations need to do this as well. Public health nurses must understand the multiple causes or health determinants that influence populations' health status. Individuals and families within populations that experience health disparities suffer consequences even if their personal behaviors and biological or genetic factors encourage health. Because of this, public health nurses must advocate for change in the societal causes of population health disparities by working at the community and systems level of practice. Working with individuals and families to help them change their own behaviors and risk factors cannot, by itself, eliminate health disparities at the population level. There are steps that we can follow to engage in advocacy. Advocacy actually begins with trying to understand the problem that you want to solve and finding others who are interested in solving the problem with you or that care about the population. Learning about an issue or a problem involves diving into the data and the stories that illuminate the nature and scope of the issue and studying the relevant policies that are already in place. It also includes finding other people and organizations that are experiencing the problem or that are sympathetic to those who are. The next step is to set goals. Once advocates understand an issue and assemble a network of people and organizations willing to take action, they must work with the most engaged actors or the group as a whole to define their objectives in a short and perhaps long term. Coalition partners rarely agree on everything, so they may most effectively work by consensus or rely on leaders respected by the group and provide direction and keep things moving. Because advocacy coalitions are voluntary, members or leaders who do not listen or work from consensus usually cannot accomplish much. Finally, an agreed upon destination helps advocates define a path or strategy for their work. When public attitudes are still a major barrier to action, the advocacy campaign might begin with broad efforts to change hearts and minds about an issue instead of directly calling for changes in law. Early advocacy can really help. It does take time to change because we're changing people's minds and then possibly changing policy, which we'll get to in later modules. Once we have done all these steps, we then need to define a plan. Strategies usually include these key elements. We have to have an explicit plan, a strategic advocacy plan that includes a realistic timeline with a roadmap for what needs to be done, when it needs to be done, who is responsible, and who will be providing the funding. We also need to identify a target audience. Advocacy is always aimed at other people, such as policymakers with powerful interests whose action or support really helps, or the broader public. We also need to have a set of key messages that influence the target audience. At some point, a coalition must frame its goals in a way that will most resonate with the community and policymakers. This process may also involve developing responses to potential arguments against the proposal. Messaging and framing is crucial, but very, very difficult. The cardinal rule is to never assume that arguments that persuade you and your allies will actually persuade others. There are two models that we need to talk about when we talk about advocacy. The first is the collective impact model. This is a collaborative approach to solving complex social issues by bringing together different organizations from various sectors to work towards a common agenda. It's actually based on five conditions. One is a common agenda. All participants must have a shared understanding of the problem and a mutual agreement on how to solve it. The next is continuous communication. Frequent communication between key players builds trust, encourages learning, and helps to identify when plans need to change. Mutually reinforcing activities. These are the programs and services that contribute to achieving the collective impact's intended goal. Backbone support. An independent staff with specific skills provides ongoing support to move the initiative forward. Their roles include guiding vision and strategy, supporting activities, establishing measurement practices, building public will, advancing policy, and also mobilizing funding. Additionally, we also have to have a shared measurement. Participants together develop a shared measurement system. The collective impact model was first introduced in 2011 by the Stanford Social and Innovation Review by a Stanford Social Innovation Review article, and it's actually been used in communities around the world to address a variety of social and environmental issues. While the framework is relatively simple, executing the five elements can be very time consuming. It can take a lot of skill and also resources. When any proposed solution is promoted by an initiative or program that receives governmental support, there are laws that might limit or prohibit certain kinds of advocacy. It's very complex, and many public health organizations incorrectly assume that they are completely prohibited from advocacy activities, which makes their work usually less effective than it could be otherwise. Federal tax system provides important incentives to public health organizations. They can avoid paying taxes if they comply with certain statutes. In this context, lobbying may be prohibited. Lobbying is defined as seeking to influence pending legislation or federal or state governments. This can be direct lobbying, accomplished by directly sending staff members or hiring paid lobbyists to meet with lawmakers and ask them to support or oppose a specific bill, or it can be more indirectly through grassroots lobbying, in which organizations ask their members or the general public to communicate with representatives in the legislature about pending legislation. Under IRS rules, lobbying does not include nonpartisan education activities aimed at informing policymakers and the public about public health problems and solutions. Tax-exempt organizations can do some lobbying. It just cannot be a substantial part of the organization's activities. Because this standard is open to interpretation, the IRS has developed tests to determine whether organizations are exceeding the allowed amount of lobbying. The default insubstantial part test considers factors such as the amount of time spent on lobbying by employees and volunteers, expenditures on advocacy, and facts and circumstances specific to each case. Typically, lobbying is deemed insubstantial if it is less than 5% of an organization's overall activities. Too much lobbying activity subjects an organization to the risk of losing its tax-exempt status and disqualifies new organizations from seeking that status. Anti-lobbying rules also exist related to funding. Federal and state authorities support governmental, nonprofit, and academic institutions in every aspect of public health through funding. This support promotes prevention strategies, data collection and analysis, dissemination of research results, and capacity building and leadership training, and even provides services and outreach to vulnerable populations. But both federal and state funding mechanisms impose restrictions on lobbying. At the federal level, grantees that accept federal funds face restrictions on using those funds for direct lobbying, grassroots lobbying, and legislative liaison activity. The Federal Office of Management and Budget OMB, has stated that these restrictions limit the ability of grantees to lobby at both federal and state levels. However, grantees and their employees can still lobby if using non-governmental unrestricted funds. One thing that's also important to consider are lobbying disclosures. Apart from direct restrictions on lobbying, some laws also require disclosures of lobbying activities so that the public can understand the players and resources that influence legislation at all levels of the government. The Federal Lobbying Disclosure Act requires organizations that spend over a certain threshold of money or time on federal lobbying to disclose their efforts. State and local laws impose disclosure requirements on all kinds of organizations, regardless of federal tax or funding status. Noting all these things, it's really important that when you go to work in a public health agency or somebody that supports public health, that you check with your lawyer and prosecutor to make sure that you're following all rules appropriately. These are the references for this slide deck.